Let's catch up now with an expert view on the latest situation and go again to the infectious diseases physician, Professor Peter Collignon, joining us from Canberra. Good to talk to you again, Peter. We've talked a lot about being prepared to live with the virus with 70% vaccination rates. We're on track to do that before the end of October. Obviously, best to start that process with little infection around. What happens now when you've got over 600 infections in a single day in Sydney? Do you see that there's any hope for these lockdowns to actually dramatically reduce that rate of infection? What would happen if we lived at that rate of infection all the way through to 70% vaccinations?
Well, I still hope that the numbers will level off and come down, but the reality is it's going to be quite a while from that number per day, and particularly since one person still seems to be giving it to more than one other person, for it to get down to zero anytime soon. But there's still good news in Sydney. Most of Sydney doesn't have a widespread outbreak. If you like, the restrictions and lockdowns seem to be working. Even the Eastern Suburbs where it started, there's not many cases occurring per day. So, and Fairfield, I understand, is the same. So I don't actually think we all should throw up our hands in horror and say there's nothing you can do about this, but it's not going to change in a hurry. But the most important thing is the vaccines. The vaccines markedly decrease the consequences of infection. Not that you still can't die, not that you still can't even get very sick, but you probably have a 20, 50-fold reduction, particularly in your death rate. So it actually means the consequences are much less, and also the spread will be less, because while it doesn't stop you getting mild disease and passing it on to others, it still markedly decreases that risk. So the way out of this is to decrease and keep the infections as low as we can, but to get that vaccination rate up, because once we get to the 70 or 80%, the roadmap that we had for Australia anyway was that you would go and do a whole lot of more normal things. Not that you'd go back necessarily complete normality. You'd still have to do things to decrease transmission, and you might have, the restrictions in some areas more than others. But it was designed not to have border closures, to allow people to go around a reasonable amount of work, because while the virus might spread, the consequences would be far, far less, and the spread would also be less.
Tell us about the lockdown provisions. As I've highlighted at the top of the program, some people are pushing for tougher lockdown in New South Wales, pointing out measures that exist in Victoria and elsewhere that are tougher. One of them is a curfew. For instance, what would a curfew help?
Well, as far as I can see, I haven't seen any evidence that a curfew would help much. I mean, yes, I guess it might stop people, make them be in the home at 9 o'clock, but how many people were moving around that shouldn't between 9 and 5 in the morning? The essential workers have still got to move around. They will be pulled over. It takes up police work and time from everybody. But is there really a lot of evidence that people who are spreading a lot of infection are doing it 2 or 3 o'clock in the morning? I don't think so. So not that you may not have any benefit, and I guess it actually is easier to police, but overall, it's not going to have a big effect. It's the same as, I would think, playgrounds, etc. Providing people keep their distance outside is much safer than inside. So you've got to be really careful about measures you put in place, that they're proportionate to the benefit you're going to get from them. And even in Sydney, it's hard to see, well, what more else could you do that's going to make a lot of difference? Yes, we need the people to all get on side and intermingle with less people, but it's still essential workers that are mainly getting the infection, then bringing it home and spreading in their families. Now, I think more eye protection is a good idea. Face shields, we tend to ignore our eyes too much, and you're just as vulnerable to infection through your eyes as through your nose. But other than that, and making sure in staff rooms, tea rooms, etc., in essential workplaces that people aren't intermingling, eat outside, drink outside, etc. It's hard to see what you could do more that doesn't start really interfering with basic functions like food delivery, petrol delivery, healthcare delivery, etc. So there's a balance here about how much extra benefit you're going to get from some fairly more draconian things, but really, do they make much difference?
Yeah, important points there. Just to recap, though, you're saying the good news about New South Wales is that the bulk of those infections are concentrated in those areas, which are sort of super locked down at the moment. And just again on playgrounds, because I'm about to take up this issue with another guest, but on purely medical grounds, not much of an argument for shutting playgrounds, surely.
Yeah, well, look, if you look at anything around the world, you're hard-pressed to show much transmission outside. You can actually give it to other people if you're up close and etc. But the risk is really low. And playgrounds, have we seen a lot of spread that way? Now, admittedly, you don't want everybody cheek to jowl in a playground. You've got to be sensible at keeping distance from non-family groups, etc. But, there's a lot of psychological damage if you can't go outside and do things. And if you get very little extra spread by allowing that, but a much bigger psychological boost, you've got to actually weigh that up because, look, if you've got 600 infections a day and you maybe stop one by having playground closed at the most, well, you could argue, is that worthwhile, particularly if there's great benefits for people being outside, being able to do some exercise, and particularly children being able to get around and run around.
Indeed. Thanks so much for joining us, Peter. I appreciate it.
Thank you.